athletes, it's Dr. Jackson from the Sports Pod, and I want to talk to you a little bit today about something that I've, you know, been mulling around in my head a lot lately. I've been seeing a lot of, athletes with, shin splints and, foot pain, and, I just want to talk about, a common injury out there that could actually present itself with some of these symptoms. So that is going to be a stress fracture. So some people may not be aware of what a stress fracture is. I'm just going to try to give you a brief overview, kind of clear up some of the questions that you may or may not have, and kind of go from there. So a fracture is when you have a break in the bone. So it can be a hairline fracture, which is very small. It can be a partial fracture where it doesn't actually go through the entire width of the bone. It can be a complete fracture where it's completely through the bone. It can be comminuted where it's just a bunch of different angles and shards going everywhere. But the stress fracture, or some may call it a fatigue fracture, is basically due to an over stress or repetitive stress injury to the bone. And essentially what will happen is the bone will break down and you'll get a fracture. So oftentimes it's very small. It could be a hairline fracture. And most of the time it's not going to show up on an x-ray right away. So sometimes it may take up to a week or even 2 weeks to actually determine if you have a fracture in that bone. So let's say you've just increased your training. So you increase the intensity, you increase the volume, and maybe even you change like the surface that you're used to training on. So maybe you go from like trail running to concrete, and all of a sudden you start having pain in your shins. Oftentimes if you go ahead and rest, that'll help. But let's say you do that and you keep getting back into running and it's just not going away. So you're like, well, let me go see, what's going on. Maybe you get an x-ray and it's clean, The best way to actually determine if you have a stress fracture is to get a bone scan. Having said that though, you usually don't go the bone scan route until maybe a week or 2 weeks out after you've taken one or maybe even two follow-up x-rays to determine if there actually is a fracture. An MRI is a good route to go. It also lets you, determine if there's any soft tissue involvement, which you're not going to get, with an X-ray. So having said that, how do you get a stress fracture? Well, there are some things that predispose you to having a stress fracture. Oftentimes, it's going to be individuals maybe in that 18 to 25, late 20s range. That are going to have an injury such as a stress fracture. Oftentimes it could be an increase in the volume or intensity of your training, like I mentioned earlier, or maybe just a decrease in the amount of rest period. So maybe you're keeping the same intensity, but instead of working out maybe 2 times a week, you're working out 5, 6, 7 times a week. And it's just all that repetitive trauma, repetitive stress and striking and weight bearing that your body's not used to. And essentially the bone just kind of breaks down. Also, certain things like, an increased Q angle, or maybe if you're a female, kind of predispose you to these things as well. But that's pretty much it, guys. That's a stress fracture. What it is, how you get it, some of the particulars, and maybe how to diagnose it properly. If you feel like you've got something like this going on, go ahead and come see me at the Sports Pod. I can check it out. I can also, get you a referral to get, some proper imaging if we feel like that's necessary. Feel free to reach me via social media. Should be down here in the left-hand corner. Hope to hear from you soon, guys. Hope you learned something too. Once again, I'm Dr. Jackson from the Sports Pod, and move free.